you know, going into a bigger institution. Was that moment of kind of graduating special?
Yeah, it was immense. Like, once I actually had received the email saying that I had been confirmed and had a place in the bachelor's course, I was so excited. Like, Lee was there when I first got my email, and I just went to her and I was like, I got into the course. Like, it was overwhelming, especially after having Arika and being able to say, I did what I came to the team parent unit for. I got my credit. I'm now just going to go do my bachelor's degree. And yeah, everything kind of just fell into place after that.
You're in Australia now, so life's kept moving for you, and I think you've got a really interesting job there actually at the moment. Can you tell us a bit more about what you're doing now?
Yeah, so after I did my first year of study, I ended up coming over to Australia, and I'm now working as an assistant educator at a daycare. Well, at the daycare that Arika attends. And the centre that I work at is a bilingual, multicultural centre called Kiwi Kids. And yeah, what I do is just go around to, I'm what they call a float. So I go around to all the rooms and help out where needed. So I get the opportunity to work with all different ages from 6 weeks to about 5, 6-year-olds.
Fantastic.
Older as well.
Yeah. I was just thinking also, you know, one of the challenges of becoming hapu or becoming pregnant as a young person is that you may feel cut off from your immediate peer group. You know, they're getting on potentially with very different lives. You've got your responsibilities as a mum and your studies and everything else going on. But this unit just means you have peers. You have people who completely are getting what you're doing and you're getting what they're doing. And is that very just peer support and comradeship a really important part of things, Drew? Friendship.
Yeah. I find friendship has definitely been one of the most vital parts in helping me become a good mum. Whilst I have a lot of friends that aren't teen mums, them seeing me become a teen parent has helped them gain an understanding of what it's like to be not only a mum but a single teen mum. And so they've seen me grow up quickly, which has kind of helped them to do the same as well. Because, like, I think they realise that life's not always going to be about partying and going out and having a good time. Like, sometimes you're going to have to settle down.
Kia ora. Kia ora both of you, Drew, and kia ora koroa, and stay with us because we're going to bring Lee in now, Lee Marchione, head teacher. And Lee, as we said, you have a really personal connection to your job. What was your view on doing the documentary series and on putting your life out there and everyone's lives out there? What were your thoughts about it?
Well, originally it was just the opportunity to actually let people know what we do. Lots of people, like Kira said, don't realise that the teen parent units are there because it's almost like we don't want to be promoted because people think we're going to be there for promoting teen pregnancy. Like, hey, let's all go out and get pregnant and come here. And so they're there, but they're just such amazing places. And I suppose when I went into the job, that's when it just really started hitting a lot of the things that I'd gone through myself and hadn't realised I'd actually just sort of closed them off into a box, and actually started dealing with a lot of the things and a lot of the stereotyping. And so because I had that connection, the conversations I can have with the girls are really open and honest because we're both, we've had similar journeys. And so I think there's just an openness and a bit of a caring and empathy there, and understanding all the complications of, and how you're feeling and the anxiety about telling your family that you're hapu, how they're going to react to you, how your friends react to you. Yeah, it's just, I suppose what's important for also to support them to tell their story.
You've also told your own, and when you look at what they have here now, and the support and the facilities and the opportunities that they have at He Puāwai, was that your own story, or was it different for you?
Oh, very, very different. I mean, and lots of women I talk to around similar ages to myself are like, wow, they've got something like that. There was never something like that there, and it's a lot more acceptance now. I used to get stared at going through the campus with a pram, and things like that, whereas I think that that's a little bit more accepting, but just the fact that we are in a country that has these units and that they are flourishing and doing so well, I think is pretty awesome.
Have you seen attitudes change over the decades?
Yes and no. There's still people that can be very quiet, very bigoted, very opinionated, almost like that shame and tarnish of becoming a teen parent. Yet there's others that hear about us and just think it's amazing. So I'm hoping that through this documentary there'll be a lot more people that see the benefits of what we're doing and the impact on the life of that young mum and their child and the positives of it, and not the negatives.
Well, what is the stigma and the judgment that remains, or the assumptions that remain?
Still that you've done something wrong, like Kira talked about. You've done something wrong, you've ruined your life. The whole thing about being sexually active, that you've been really careless and obviously haven't been taking any contraception, and that's very wrong. Things can happen while you're on contraception, and also just the fact that these young girls have chosen to keep their babies is massive. So there's just still a lot of judgment that is still out there.
The education itself, the role of education, getting these qualifications done, keeping a pathway open to do what you want to do for yourself, as well as caring for and raising your pepe. What's the approach on the education side of things? Is it simply these young women should not miss out on anything that any other student is getting? How do you go about it?
Yeah, well, it's pretty much, having that education gives them their future, a career that they want to build for their families, like we're working women, and just because you've had a child, you shouldn't therefore be shunned from your school. There's still high schools in New Zealand that would expect their students to leave their high school if they became pregnant. It still happens. So if there's a teen parent unit, they can actually carry on. And it's like what Kira is saying, the confidence that you get from passing NCA, passing your UE, actually getting your goals like Drew did, gives you that confidence as a young woman to go, I can do this and I've got a career. Rather than, I didn't pass school, I've just got to do that job, there's nothing much for me, and believing all that negative stuff like my life's over, I've just become a mum.
You wondered too, like you stayed on, I think, in your in your own experience as a teen. I think you stayed on, went through university, but many of young mums have done it a few years back. Would that have, doing it on your own,
I think lots are probably studying in their later years. They've brought their children up, decided, no, I don't want to be doing that job that's not going to take me anywhere, and they're studying at a later life. So we're hoping with now, it's sort of like they're getting those qualifications early and they're bringing their children and their families up, and everyone's better off.
How many educators are there, teachers are there? How do you actually sort of practically operate with? How many students can you take at a time? It's 20 to 30, isn't it?
Here Puawai is funded for up to 30, and we have around 5 staff that work part-time, full-time, and so every student's on an individual plan. So if, like, for instance, Kira had her plan for what she wanted to do at level 2, Drew had her plan for university entrance, so everything's tailored around the individual. So it's not like school, it's like more like alternative education, but it means the girls can just focus completely on what they want to do on their path. If they're not sure, we try and keep it broad. It's working with small groups and individually, so we often fill a lot of gaps. A few of our girls might have left school in year 9 or 10, and we're actually going back and supporting them to fill the gaps to then move on to NCA. So it's a lot of individual plans. We meet as a team quite a lot to look at how the girls are going across the board, looking at what we can do to improve and work around them, because they can have an immunisation one day and then they're in the next, or a baby's sick and they need to take them home. So we have to be as flexible as a team as possible, and not let those barriers stop them from achieving.
And parenting itself, parenting skills, which is a very sort of, clinical word, isn't it? But, it's pivotal for any new parent to learn the practical, but also just the emotional skills and coping skills. Yep. And is the part of what happens just organically when you're surrounded by such support and experience and by other young mums, or is it actually part of the curriculum?
It's definitely a bit of both. Like you're saying, it's organic around the girls. The girls are amazing at, saying, I did this with my baby and my baby had this, and give each other advice. They're really awesome with that. But we also have someone that comes in and does positive parenting workshops.
Well, kia ora koutou. Today I am releasing the Health and Disability System Review. First, the good news, it confirms what I think the COVID-19 global pandemic has shown us all. We have a very good health and disability system. The response of our health and disability services to the virus demonstrated many of the strengths of our current system. Our health response has been based on world-class expert advice. It has been flexible, it has been quick to adapt and scale where needed, and it has worked well. We've always known our health workers respond well to a crisis. The ongoing challenge is to ensure this flexibility, responsiveness, and cohesiveness becomes part of business as usual. The review is very clear. We can do better. The review found that our health and disability workforces are under considerable stress, and our system is complex and fragmented. It sets out a path towards a better, more sustainable health system with clear lines of accountability, one that is more responsive to the needs of local communities. This is particularly important when it comes to improving health outcomes for those most in need, including Māori, Pacific people, the disabled, and rural communities. The review has made a series of wide-reaching recommendations, which you have all now had the time to read for yourselves. The report recommends the most significant changes to our health system in a generation. They include recommendations for structural change, stronger leadership, and a determined focus on population health. My focus from the outset as Health Minister has been on equity of access and outcomes for all people. The review's recommendations build on that equity agenda. Local planning must drive decisions. Our health and disability system needs to better understand the real needs of the community and when and where services should be available. Cabinet has accepted the case for reform and the direction of travel outlined in the review. Specifically, changes that will reduce fragmentation, strengthen leadership and accountability, and improve equity of access and outcomes for all New Zealanders. What that means is we are committing to an ongoing program of reform to build a stronger health and disability system. Decisions on individual recommendations will be taken to Cabinet over coming months and into the next term of Parliament. This will take time. You can't make changes to a system as large and complex as our health and disability system overnight. But this is a once-in-a-generation opportunity to tackle the long-term challenges our health and disability system is facing. we can build a stronger, more equitable health system that works for all. That is nothing less than New Zealanders deserve. Before I take questions, please let me touch briefly on the next steps from here. Cabinet has agreed that a small group of ministers should drive these reforms. That will be led by the Prime Minister and will include the Finance Minister, myself as Health Minister, and Associate Health Minister Penny Henare. I will also be appointing a ministerial committee under Section 11 of the Public Health and Disability Act to provide ongoing expert advice on implementation and improving system performance and equity of outcomes. And an implementation team will also be set up to lead the detailed policy and design work. It will be administered by the Department of Prime Minister and Cabinet, as is common with significant change. This is a sector full of hard-working people who want the best for their patients. We want to build the workforce and make sure the system is set up in a way that makes it easy to deliver the standard of care and service our health professionals want to deliver for New Zealanders. Happy to take questions.
To adopting all of the report's recommendations?
The direction of travel has been agreed by Cabinet. The individual decisions on the recommendations will be taken over time, some now, but predominantly under a future government.
Quite clear, it says that very few of the recommendations are standalone, and that the lesson from past reviews is that it can't be done piecemeal. So will you commit to adopting all the recommendations wholesale?
Well, the point of setting up an implementation unit, a transitional unit, is to work through the detail. The report's recommendations don't actually describe how it will be implemented. They describe the change that needs to happen. The actual implementation will be worked through by that transitional unit. There'll be legislation drafted, and that legislation and the policy that sits alongside it will come back to Cabinet for final decisions.
A more specific timeline on that. You've kicked it to after the election. Can you give us any more specificity around when this might go before the House?
Oh, look, I would be expecting a new government would want to progress this as quickly as possible. The direction of travel is very clear. And the opportunity is huge.
So you'd say that this set of reforms would be a key part of the next government's agenda if it is re-elected?
Certainly, and I mean the report has been written in a way that I think any incoming government would want to pick up its recommendations. It's essentially a 3 to 5 year program of change that's been outlined, and it's been done through thorough consultation with the sector. It represents the views widely shared across the sector, the need for greater accountability, for making sure that population health, primary care services in the community are available to people when and where they need them, and the structures that could be set up to make sure that...
Putting on your Labour health spokesperson hat, do you endorse the whole report and its recommendations as the Labour health spokesperson?
Oh, look, I certainly accept the direction of the report. I think the detail will need to be worked through by the implementation panel, but actually there's not a great deal in the report that I would disagree with.
Will you put the report to Labour caucus?
The report is now going to be publicly available for the whole of New Zealand to look at and for people to work through. I'm sure we'll see feedback from the sectors, and I would hope that the majority in the health sector support the general direction too. There'll be things, of course, that individual groups might not be happy with this change or that change, but the direction outlined is something that people have been crying out for a long time.
The reduction of DHBs?
Absolutely. The report identifies that we were likely to have roughly half the number of DHBs in 5 years' time. Now, there's a time frame on that because we actually need to make sure we do the locality planning properly first. There's a lot in the report on making sure we have plans in place to make sure that services are available for people in where they are and in the style that they are going to access, to make sure we have iwi-provided services, GP services where needed, other styles of service provision across primary care so that people have accessible services and also at the times they need to access them. And the DHB will be responsible for that population health planning and accountable for delivery on it.
Is the Minister solely responsible for the appointment of those DHBs? Is that too much power for one Minister?
Sorry, I don't quite understand the question. Say again.
As the Minister, the recommendation is that you'll be solely responsible for the appointment of those DHB board members. Is that too much power for one Minister?
Well, those will be decisions I will take to Cabinet.
But do you personally support the removal of any democracy over in DHB boards?
Sorry, can
Do you personally support the removal of any voting on DHB boards?
I think certainly the feedback I've had from across the sector is that those people who vote in DHB elections often don't know the candidates and don't really know what those people on the boards are doing. I think the case for provisional governance has been made, alongside the case for greater engagement with the community and planning the services that will be delivered. So I think there's a balance that's been struck in the report, and it feels to me the right balance.
To get on the timeline.
Sorry, I'll go.
Do you have any idea at this stage about which DHBs you might envision being merged or disestablished?
No, I think that will be carefully worked through. We can already see DHBs working together in many ways. The West Coast and Canterbury work together closely. Across the Hutt Valley and Cap Coast, a lot of services are shared and so on. So DHBs are working together where it naturally makes sense now, but I wouldn't want to preempt those decisions. They're best made once we have a better service provision planning effort underway, and we can say that actually it makes sense to concentrate services that support that better delivery in the community.
Would you outline those proposed DHB mergers before the election, given that it's something that the voters probably do deserve a say?
I would not expect to, no. I think it's really important that the planning is done thoroughly. This is actually about making sure New Zealanders can access the healthcare services, particularly in the community, because we know when people get prevention services, primary care earlier and so on, that prevents the need for them to go to hospital later on. Getting the service planning right in the community is going to be the first and most important step, and then I think logically what will flow from that is where those amalgamations would best occur.
How are disabled people being let down at the moment?
In access to services, also, I mean, there's a really obvious point that was made in the interim report. I think that our health and disability sector could be employing more disabled people. We know that one of the biggest things that drives well-being and outcomes for people in life is the ability to access work. And our health and disability sector could benefit from having more people who have direct experience of disability and can sit alongside the provision of care.
And under this model, excuse me, how long would it take, do you expect, to address inequalities in the health system? How long until racism has been quashed?
Well, I think this is a long-term challenge. I don't pretend that these issues will be solved overnight. I think the elevation of the Māori Directorate that's proposed in here is a way of making sure we have a stronger Māori voice in the sector, ensuring that we have a balance on our boards and so on. The report is clearly focused on making sure we address that area where we know the worst statistics are. Māori people experience amongst the worst health outcomes across New Zealand. The Crown has a special relationship with Māori. We need to strengthen that Māori voice in the system. Of course, we already have Māori provision. We're not starting from scratch here. We have kaupapa Māori services. We have a Māori Health Directorate already, but it's actually about strengthening that voice. Sorry, totally.
How quickly should we set up that Māori Health Authority, and when will we see the end of institutional racism in the health system?
Well, the setting up of the authority obviously would be something that would be put in legislation, and final decisions on that will be taken by the next government.
On the timeline, this government has clearly set up health as one of the key pillars of why it wants to be a government. If you're re-elected, will implementing these changes be part of your or the next government's first 100 days?
Look, we will work through it carefully. I do want to stress that this is the most thorough look at the health sector in a generation. It is a weighty report. There are detailed recommendations in here. Implementing them will also require detailed and careful work. We've got a good health system in an international comparison. We want to make sure that we build a better one. We'll be doing that carefully, but we'll be moving as quickly as possible.
Commit to telling us within the first 100 days which of these recommendations that the government will be implementing.
The transition unit will lay out, I imagine, a prioritised list of changes that will be made. Some of them will start straight away. I expect that unit to drive increased focus on making sure services are delivered and that the financial resources are stewarded well in the sector. That's part of the capability that is outlined for Health New Zealand. I will expect that work to be starting immediately.
For example, the changes in DHB voting come into effect before the next local body elections, for example.
Well, that detail will be in the legislation. Again, that requires legislative change. That will be for an incoming government to determine the time frame on.
On the Māori Health Authority, there was a split within the panel on the Māori Health Authority, and particularly around funding. Which side of the split do you fall on? Are you happy with how the final report has it, or would you rather that authority had its own?
accept the findings of the final report and expect that they will be put into legislation. I think it's important that the different views can be seen there because we've got a significant challenge, and what we're talking about is significant reform in the sector to try and make sure that we do address these historic unfairnesses in our system to elevate the Māori voice. Now, I see in the solution as it's proposed in the report a clear focus on elevating the Māori voice, on making sure we have boards that reflect the special relationship with Māori, and that I believe will make a real difference in terms of the outcomes for all New Zealanders, actually.
If the report's conclusion is that DHBs are too fragmented, why then do you think the conclusion is to just have larger fragments? Why not have something more substantial in terms of reform?
The report does say that one of the most important functions in the system is making sure that we have good local planning, that we actually are getting a conversation running with the community, that we're planning with the community for the provision of local services, and that the accountability for providing those services sits with the DHBs for population health outcomes, for access to services and so on. We still need those functions in the system. The report itself says we could rename them, we could call them something else, but ultimately it says those functions are still needed at a local level to make the biggest difference in our communities.
Should there be an expectation of job losses in places like PHOs?
No, this is not a job-cutting exercise. As a government, we've employed 1,700 more nurses, 900 more doctors, 600 more allied health workers. We are seeing a system that will see some growth. We want to provide services across the health system for people in need. There's also a suggestion in the report that health funding be indexed to cover demographic shifts, to give greater certainty of funding over time so that DHBs can prepare to grow services in a responsible way. It makes the point also that it's not just about the money, it's about how the money is spent. Ultimately, that's the most important thing. But it does also say that we will be looking to grow services over time.
Minister, the report talks about the need for outcome measures and targets for delivering the system set around population health outcomes. So will you set new health targets?
I expect that we will have clear measures around population health outcomes, and that's going to be quite critical to this. And indeed, some of those measures are already in place in terms of planned care. We've shifted away from a focus strictly on electives that are done in the hospital setting to a focus on how procedures are done across the sector, so that it actually incentivises more care in the community. Some of those changes are happening, but I expect there will be more in that space.
On funding, last week you got a report on the state of hospital DHB assets, which indicated a $14 billion bill to bring them up to speed. How are you going to integrate that report with the report today?
Well, they actually sit well together. We are going to need hospitals in the future. As a government, we've committed to tackling the long-term challenges. And this report focuses a lot on planning, the need for taking a longer view. The Ministry of Health will be required to set out what the vision is for the next 10 to 15 years. DHBs will be doing planning in their localities for the next 5 years. We've already sent a signal as a government that we will put significant resource into rebuilding those assets. We put $3.5 billion in our first 3 budgets. That's been set aside, on a 10-year track. The suggestion from Treasury is that there need to be $10 billion over a 10-year track. So we're running ahead of that, with $4 billion coming in from the DHBs to top it up. We're running ahead of that track, but we are absolutely committed to a strong capital program to make sure that our public assets are rebuilt and to make sure that we have the facilities we need for our communities to get healthcare.
So you will commit to the $14 billion.
Look, as a government, we make decisions budget by budget. What I'd observe is that the last government, over 9 years, put aside $1.1 billion. We put aside $3.5 billion in just 3 years. We are absolutely committed to rebuilding our hospital infrastructure.
So, Minister, how did this report... The report doesn't make a firm recommendation on changing the rules around the DHB, around the capital charge. Would you commit to doing further work on that in the future of the capital charge?
We've already, that's the kind of detail that will be worked through. We've already obviously set aside the capital charge for new builds, and that, because it was identified that capital charge was actually acting as a disincentive, and that projects like the Dunedin Hospital project were put off because of the disincentive of the capital charge. So for new builds, we've already set that aside. We have made some changes, but that further detail around capital charge I'd expect to be worked through.
Minister, as Health Minister, how did this make you feel, this report, when it first landed on your desk?
I have to say pretty excited. Commissioning this report was one of the main reasons that I took on the role of Health Minister. The sector itself had been giving me feedback in opposition, and that was reaffirmed in government, that it's ready for change. It is ready to look at how we can deliver things better. Whilst the sector compares very well internationally, everyone agrees that there is an opportunity to make things better. And this report lays out a clear runway for doing that, for making sure we deliver better healthcare for all New Zealanders. And so I'm quite excited by the opportunity.
Sorry. There have been calls for years now, but amplified by the pandemic, to have a separate public health agency. This doesn't exactly go that far, but what are your thoughts on that proposal? And
this report wants that public health population function across everything. You know, it basically says, let's not set up a siloed agency. Let's make the Ministry of Health responsible for population health outcomes, for planning towards better population health outcomes. Let's require our DHBs to do that planning. Let's require Health New Zealand to be operationalising that, having oversight of that, providing best practice to the sector, so that we do have better public health and population health outcomes across the whole country. So it kind of essentially, in one sense, goes a step further than that. It says this has got to be the basis of our health system. That's the really significant challenge presented in this report.
It sets out a really bleak set of financials for DHBs across the country and says that over the forecast periods of the next 4 years, essentially, DHBs on average are going to be in the red by $1 billion per year. Do you think that going forward, adjusting how many DHBs there are across the country will help with the dire financial situation that DHBs across the country are in?
Well, first thing I'd say is, we've put in a record amount in this most recent budget, and our two budgets before that were really big too. They were records in their own right. This one is really kind of unprecedented in the investment we've put in. But the expectation is that if we set up an agency in the report provisionally called Health New Zealand, that it would have the oversight operationally of all the DHBs, and it's an independent Crown agent. It has the ability there as a Crown agency to have a much stronger governance function across the sector, and also with the appointment of professional governors across the sector, I think we can really strengthen the financial performance of our health sector. I think it will make a meaningful difference. There are no doubt have been historic financial challenges, and
what does that mean in terms of dollars and cents?
I'll just finish. The balance sheets of the DHBs started to run dry in 2013. You can see the pattern of deficits emerging from there. Part of it is acknowledged as funding, but part of it is also in making sure we have clear lines of accountability and good structures for governing the sector to make sure it's both delivering the services we'd expect, and that's got to be the first priority, but also making sure that it's held to account financially. And I think this new structure proposed in the report is certainly a clear way of doing that.
What does meaningful mean in terms of dollars and cents? If we're looking at billion-dollar deficits for the next 4 years, what is your success metrics in terms of financial losses, or in terms of, are you expecting surpluses?
Look, I expect DHBs to return to surplus over time. That has always been the case. And where we've had specific DHBs that have had financial challenges, as Minister, I've shown very clearly that I'm willing to act. I put Crown monitors into DHBs. I've actually put a commissioner into Waikato. And those DHBs where I have acted to strengthen the boards through additional governance, and you'll notice the direction in the report, have started to turn around. We are seeing performance changes, and we know that if we strengthen the governance on those boards, it makes a meaningful difference to how they operate. Yeah.
Minister, there are some really weighty recommendations there. Where, in terms of a timeline, would an overhaul of the disability system sit for the government?
Well, that again has got to be worked through. All of these things need to be done and attended to and set on a trajectory sooner rather than later, would be my observation. There's no, disability is incredibly important in terms of our health and disability sector, but across the, it is incredibly important. There are many things in here which need immediate attention, and the report says we just need to get on with it. And making that change, getting that group up and running to do the implementation, to work out how those recommendations are turned into implementation on the ground is the first thing that we're going to set out on.
Concrete recommendations that will lift those disability communities, out of the poor outcomes that they're seeing at the moment.
Well, I mean, you've had a chance to look at the report. I mean, one of the most obvious things I've already touched on is making sure that we actually have people in the system planning for and making a meaningful difference by working in the system. Having people able to serve as disabled people in our health system in greater numbers. That will actually, I think, make one of the most meaningful differences. We've also got in the document itself a need for workforce planning, which goes to the same point, and that's across a lot of different areas to make sure that we have workforces that look like our population, look like the populations they're serving, and that we've got a runway of people coming through to make a difference in terms of equity.
Workforce, is there other key areas that will help the disability sector in this review?
Well, I think I will have to come back with you in terms of specifics of other initiatives in there that I think would drive the biggest, what would drive the biggest change in terms of disability. But again,
No?
obviously the workforce one is very much front of mind for me because I do think that will make a real meaningful difference.
Are you committed?
That change to PEG health funding, vote health funding to demographic and population changes, that would be an enormous change to the health budget. Do you, as a Labour health spokesperson, endorse that change?
Oh, look, I think it's absolutely an important change that DHBs need to have a view to what funding is coming so that they can change the services in their vicinity to meet local need. And it's been something that's been fed back to me consistently through my time as Health Minister, that the planning functions that were done away during Tony Ryle's tenure have actually meant that the sector itself has then focused on the annual reporting, the annual planning, and it's been a year-to-year thing. How much funding are we getting next year? Which services are we going to need to crimp or build in the next year? It hasn't allowed for that longer-term focus and the ability to say, where do we take things from here? How do we make sure that when we make change, we can be sure that we've got the funding to back it up, to deliver on the change? And so I think that we need to look very seriously at how that funding goes. Obviously, that's a conversation the Minister of Finance needs to be involved with as well. And so I'm very pleased that he's on that group alongside the Prime Minister.
Minister, just to clarify, are you committed to slashing DHBs?
I'm absolutely committed to fewer DHBs, yes.
And given you were so excited when this report landed on your desk, why not just commit to everything in it, to implementing all of the recommendations?
The report itself has got very detailed recommendations over a wide variety of areas, and you've had the chance to look through it now. You'll see that this is a complex sector, as I've heard you acknowledge publicly. There is a lot in here to be worked through, and it's all connected. And so the implementation is actually the thing to make sure we get right, that we accept the direction of travel, but actually as we work through the implementation, that will be the job of that transition group, we need to make sure that we get the detail right.
Commit to implementing the lot.
Because obviously, as we go through the implementation, any things that could be refined or made better will become apparent. It is the work of that group to look at how we do the implementation correctly to make sure that we give effect to the direction in the report. It's also true that some of those decisions, when they come through to legislation, as with any legislation, in my experience as a Cabinet Minister, when the legislation's drafted, it brings up further nuanced questions that need to be answered. That'll be for Cabinet to address, both in terms of policy and the legislation that comes through.
Also identifies oral health as one of the most chronic health problems. Is the government still considering subsidised oral health care for adults?
I think the first thing to say is that the most important thing, and health professionals will acknowledge this, is getting right access to services for our young people, and particularly for our young children. The oral care of a child at age 5 predicts age 26. We know that. And so making sure that access piece is working and population health outcomes are being improved at a local level, and that oral health is be one of the things you'd want to see improvement in across the country will be the first priority. I think as a government with a Labour flavour, you would want to see improvements in access over time.
Including to adult patients, so subsidised oral health care.
Look, I'm not making a commitment to that today, but I would say, you'll see the direction of travel. We've made significant changes in terms of the community services card access, $20 to $30 on cheaper access to doctors' visits for over 500,000 New Zealanders. We're going to want to make services more affordable and accessible, and actually across the coalition government there's agreement that we want to make services accessible and affordable.
At Labour flavour, the ministerial group who proposed has
only Labour MPs on it. Is that telling about where kind of Cabinet sits on some of these recommendations?
No, that's about the functional responsibilities. I mean, the actual administration of this sits with the Department of Prime Minister and Cabinet, as you'd expect, with a significant sectoral change that affects the Ministry of Health and other central organisations. The Minister of Finance obviously is crucial to decision making, and Minister Henare is Associate Health Minister, particularly with responsibilities in the area of equity and Māori, is a logical person to have on that program.
Already said that they don't agree with the non-election of DHB members. Do you know, is there anything that New Zealand First is particularly uncomfortable with?
No, I think, look, everybody's signed up to the direction of change here, and those things that may prove to be talking points or for different parties with their own memberships will be things that will be dealt with in the legislation that comes through. That will be up to a new Parliament to finesse with the legislation that's proposed.
So what exactly do you mean by a government with a Labour flavour? Is that sort of the same thing as a Labour-led government?
Yes.
Yeah, why not just say, I'm just curious.
I would say, I'm happy to say a Labour-led government, and that's all I'm hopeful that we'll have.
Minister, in your opening remarks, you talked about, you said this confirms what COVID-19 taught us, that we had a good health and disability system, but the review talked about the system's emergency preparedness needing to be better connected and having sufficient resilience to cope with emergencies and outbreaks. So are we not adequately prepared for a pandemic if it had reached the levels that we saw?
Look, I think in terms of the pandemic, the results there are ultimately the thing that speaks loudest. We've had a health...
It wasn't overrun like it was in places like
right. The government made choices to go hard and go early in our response so that we stopped a rising tide of COVID in this country. But that was on the back of health advice from the Director General that said, you know, here's a proven international way of addressing these issues. So do we know more now than we did before COVID? Yes, absolutely. Did we witness during COVID a health system full of people who wanted to do the right thing and get on with it and did the right thing? Yes, and I'm very proud of the way in which our health system and the people in it responded in the situation of crisis. The point I was making in my opening comments is that we need a health system that responds all the time, that's flexible, that will do things differently and that will deliver the results for all New Zealanders. So just to go beyond the COVID response itself, which showed it's capable of that, we need that baked into our system so that it continues to improve. And this report, I think, highlights the importance of population health, which is important in that emergency context, but also is important long term in how we move towards those changes.
There is a second wave of COVID-19 in New Zealand that we will be adequately prepared.
We have no evidence of that, and obviously we're working very hard to make sure that our borders are tight so that we don't have a second incursion. But if we do have it land on our shores, we are much better prepared now, even than we were back then. And the world knows a whole lot more about COVID. We had our first case 2 months after it had a name. Globally, it wasn't even something that was known about last year, and we responded as a health system. But all the while, even on the way through as we responded, we learned a whole lot more, and the science is still developing. We're still learning week by week new things about COVID, how it's transmitted, who we need to look out for, what different strains are out there, and so on. And that will continue to be the case. We will continue to learn. In terms of preparedness, though, I would observe we had an influenza pandemic plan that was prepared by the previous government and that was tested by this government. And actually, that's one of the things that did put us in a good position because we had a good starting point for dealing with a pandemic. Obviously, that then needed tailoring to the specific situation.
Specific Māori health targets?
Population health is very much the focus of the report. The measures that will be put in place at a DHB level will be different, but will align with what's put in place across the country. I'm not committing to specific measures or targets today.
The second wave of COVID-19, because that requirement for contact tracing for businesses is not in place anymore, the Ministry of Health have said that they'd essentially have to resort to public appeals through the media to contact trace. Is that good enough? Why isn't that restriction that was under level 2 in place under level 1?
Sorry, I'm not sure I understand the question.
If someone tests positive for COVID-19 and they visited a cafe or something, they might be able to tell the contact tracers, but in order for the contact tracers to find everyone who was at that cafe, they'll have to go through the media.
Okay, well, firstly, I would encourage people to download the government app. It is something that I've been using. It's very easy to use and now has the functionality that if there is a case, as you suggest, at a cafe, that a message will be sent out to your phone if you're somebody who's clocked in there immediately, telling you that you should self-isolate and seek medical care if you were indeed at the same place at the same time as somebody else who was using the app. So there's opportunities there in the provision of that technology. Contact tracing is a manual task. It always has been. The phoning and so on, that will always be the backbone of what we're doing in our public health response, and ultimately it's been incredibly successful even before we moved through the different stages. We could see that public health response is the most important one. We've now stood up a whole new system, electronic system, which means there's transparency across the country, the ability to track cases, and I have confidence that we've got now better resource and a better system in place than even as we had our previous success. I'll take 2 more questions.
Has the health system failed Māori?
I think Māori have been not well served in our health system historically.
So will you set up specific targets for Māori?
Look, I think that's certainly something that will be looked at, but I think we need equity measures across things and we need better data, and that's one of the things that is really highlighted in this, is we actually don't always have as good a data across the system as we need. For example, it suggests broadly that the population health funding approach is the right one, but unless we have a good understanding of what the need is in those populations, then how do you distribute that money fairly? So there are a lot of aspects that will need to change, and I expect that with the structures that are proposed in here, we'll have a stronger Māori voice by taking the existing Māori Directorate and putting it alongside the Ministry, directly reporting to me, that we will then have a much stronger Māori voice in the system, and actually we will learn from that stronger Māori voice what is needed to reinforce a system that delivers for all New Zealanders, no matter who they are and no matter where they are. I'll take one more.
You had to put more weight on ethnicity as recommended. Is that something you directly want to do?
Yeah, we know that Māori have amongst the worst health statistics in our country, and that is a national shame. We know that the changes that are proposed in this report will make it better for all New Zealanders to receive healthcare if they can receive them in their localities, where they are, when they need those services. And so I expect that the changes proposed in this report will actually make our health services more accessible in communities for all New Zealanders. Thank you very much.
For people on surgical wait lists?
I've answered that question for you already, Tova. Thank you. Thanks, everybody.